Why cases of patriotic asthma dropped drastically during the Covid-19 pandemic. Welcome to Inventiva, I'm Oishi Banik, back with a new story. Lockdown restrictions, shut schools, social distancing, mask wearing have made an impact. It has taken a pandemic to understand the importance of school-related respiratory viral infections as one of the major factors of asthma exacerbation in children, and how wearing a mask can be a protective measure against this disease, said experts. Asthma cases plummeted during pandemic. Dr. Sandeep Salvi, chair of the Chronic Respiratory Disease Section, Global Burden of Diseases India, said that asthma cases plummeted during the pandemic. Before the pandemic started, over 60% of children who visit a pediatrician in India did so for respiratory systems, and a large proportion of these were for asthma. The shocking reduction in the number of pediatric asthma cases visiting a healthcare facility actually came as a boon, Dr. Salvi said. There was a remarkable change worldwide and a similar trend was noted in India, Dr. Salvi said. According to the latest Global Burden of Disease report, there are an estimated 3.4 crore asthmatics in India, of which around 25% are children. Although India has 11% of global asthma cases, the country accounts for a shocking 42% of all global asthma deaths. Respiratory viral infections recognized trigger for attacks until recently. Based on research in the Western world, it was believed that asthma was mostly caused and triggered by a whole host of environmental factors, including allergens from plant sources, animal sources, dust mites, house dust, deodorants, and perfumes. Respiratory viral infections were also a recognized trigger for children asthma exacerbations, but did not receive much importance, Dr. Salvi said. According to the expert, a potential explanation for why asthma in children plummeted during the COVID-19 pandemic is that children did not attend school and stayed at home due to the pandemic and lockdown. As a result, there were no respiratory virus infections among children, which would have otherwise happened had the children been going to school. On an average, a child develops between 2 to 5 respiratory viral infections during a year, and this becomes a reason for exacerbations among children suffering with asthma. Pandemic taught importance of hand hygiene. Mask asthma is a huge and growing problem in India that demands attention by policymakers and healthcare providers. Wearing a mask can be a protective, useful measure against asthma. While schools will eventually reopen, experts like Dr. Salvi and others have said this pandemic has highlighted the importance of avoiding respiratory viral infections in schools. Wearing a mask not only protects against the COVID-19 virus, but will also protect against catching other respiratory viruses.